Listen, your knees bear 1.5 times your body weight with every step you take. So when they hurt, everything becomes harder. Knee pain is one of the most common musculoskeletal complaints in the entire world, affecting people of all ages, whether you're an athlete, someone who works on your feet all day, or dealing with age-related wear and tear. Knee pain can seriously impact your quality of life. I mean, it affects your ability to walk, climb stairs, exercise, work, and do pretty much any basic daily activity. Listen, I'm Dr. Marshall Bahr, and I'm a physician who evaluates and treats patients with knee problems regularly. And today, I'm going to explain the most common causes of knee pain, how to tell what's causing your specific knee pain, and what you should be concerned about, and more importantly, how different types of knee pain are treated. So whether you're dealing with acute or new knee pain from an injury or chronic pain that's been building over time, this video is designed to give you the medical knowledge you need to understand what's happening and what you can specifically do about it. Now, to understand knee pain, you need to understand basic knee anatomy. Your knee is the largest joint in your body, and it's surprisingly complex. I mean, the knee joint consists of 3 bones. You've got your femur, which is the thigh bone, your tibia, which is the larger lower leg bone, and your patella, which is the kneecap. And these bones are all held together and stabilized by several key structures. First are ligaments. These are the tough bands that connect bones. Think about your ACL and your PCL. They control front to back motion. And then you've got your MCL and LCL, which control side to side motion. And then next is the meniscus. These are 2 C-shaped pieces of cartilage that act as essentially shock absorbers between your femur and tibia. Next is the cartilage, which we call articular cartilage. It's that smooth coating on the ends of the bones that allows them to glide smoothly. Then tendons. These are what connect muscles to bones. So think about your quadriceps tendon that connects your thigh muscles to your kneecap, and the patellar tendon, which connects your kneecap to your lower leg bone, which is that tibia. And then you got the bursa. These are fluid-filled sacs that reduce the friction between the tissues. And when all of these structures or any of these structures are injured, inflamed, or worn down, that's when you develop knee pain. The location, the quality, and triggers of your pain give clues about which structure is the problem. So let me walk through the most common causes of knee pain. So from most common to less common, right? So we've got number 1 is osteoarthritis, so degenerative joint disease. This is the most common cause of knee pain in adults over 50. Osteoarthritis is wear and tear arthritis, where the articular cartilage gradually breaks down. Without that smooth cartilage cushion that it's supposed to give, you get bone-on-bone contact, which when that happens, you get the grinding, causes pain, stiffness, and then swelling. So the symptoms you get are gradual, all right? The gradual onset of pain that worsen over months or years. You get that morning stiffness that improves with movement throughout the day, pain that worsens with activity, especially stairs or prolonged walking, and then grinding or clicking sensations, swelling, and reduced range of motion. Now, risk factors are things like your age, can't change that, obesity, previous knee injuries, repetitive stress on the joint, and your genetics. And then you've got meniscus tears. Now, the meniscus can tear from acute injury, meaning twisting your knee while your foot is planted, or from degenerative changes with age. I mean, meniscus tears are extremely common in both athletes and middle-aged adults. And the symptoms you get are, is pain along that joint line in the knee. It's that gap between your thigh and that lower leg bone. And you will get swelling within 24 to 48 hours of the injury. You get catching or locking sensation. Your knee feels stuck. And then you have difficulty fully strengthening your knee and pain with twisting or squatting motions. Next is ligament injuries. These are the ACL tears, and they are common in athletes who do cutting and pivoting sports like basketball, soccer, football. You usually hear or feel that pop when the ACL tears, followed by immediate swelling and then instability. Now, MCL sprains often occur from direct blows to the outside of the knee or forcing the knee inward. This is common in contact sports as well. And then PCL injuries are less common and usually result from direct impact to the front of the knee, like hitting your knee on the dashboard when you get in a car accident. And the symptoms are of these are sudden onset of pain during your injury. You get rapid swelling, feeling of instability of the knee joint, and it will sometimes feel like it's giving out. And then you get difficulty bearing weight, limited range of motion. Next is the patellar tendonitis, which is what we call jumper's knee. This is inflammation of the patellar tendon, the tendon that connects your kneecap to your shin bone. And it's called jumper's knee because it's common in athletes who do a lot of jumping, like basketball and volleyball. And pain is just below the kneecap here. Pain that worsens with jumping, running, or stairs. Tenderness when pressing on the tendon, pain that improves with rest. And then patellofemoral pain syndrome, which is what we call runner's knee. This is pain around and behind the kneecap, often caused by overuse, muscle imbalances, or tracking problems where the kneecap doesn't really move properly in its groove. And that's where you start feeling dull, achy pain behind or around the kneecap. And the pain usually happens with prolonged sitting, like we call it the theater sign. And then you get pain going up or down stairs, pain with squatting, and grinding or popping sensations in that knee. This is extremely common in runners, but also affects people who do a lot of walking or stair climbing too. Next is bursitis. This is inflammation of that bursa sac, that fluid-filled sac that cushions the knee. The most common is the prepatellar bursitis. It's inflammation of the bursa that sits in front of the kneecap. And this is when you start getting localized swelling. Often you can see the fluid-filled bump sometimes, and you get warmth and tenderness with touch over the affected area. You get pain with kneeling or direct pressure. Usually no pain with walking or other movements though, which is good. Bursitis is common in people who kneel frequently. Think of like plumbers, carpet installers, or even gardeners. Next is ITBS, IT band syndrome. The iliotibial band is a thick band of tissue running from your hip to your knee on the outside of your leg. And when it's tight, it can rub against the outside of your knee, causing inflammation. And then you get sharp and burning pain on the outside of your knee. And the pain will worsen with running, especially when you're going downhill. And pain that starts after a certain distance or time of activity will happen too. And sometimes you start feeling that snapping sensation on the outside of your knee when you're running. This is very common in long distance runners and even cyclists. Next is what's called a Baker's cyst. This is a fluid-filled swelling behind the knee, often associated with other knee problems like arthritis or meniscus tears. You get swelling behind the knee, that feeling of tightness or fullness, pain that worsens with knee extension, and then occasionally it can rupture suddenly and cause calf pain and swelling in that area. I think what I really want to drive home is it's important to distinguish between acute and chronic knee pain because they often have different causes and treatments. Acute knee pain comes on suddenly, usually from a specific injury or event. You can point to when it started, like I twisted my knee during basketball, I fell and hit my knee. Acute injuries include like ligament tears, meniscus tears, fractures, dislocations, and acute tendon injuries. And then chronic knee pain develops gradually over weeks, months, or sometimes even years. And you can't really point to a specific injury. It might start as a mild discomfort and then progressively worsen. Chronic knee pain usually comes from overuse, like repetitive stress movements, biomechanical problems, or degenerative changes like osteoarthritis. Now, understanding which category your knee pain falls into helps guide the diagnosis and treatment. Acute injuries often need imaging and usually require surgical repair. Chronic pain usually responds to conservative treatment like physical therapy, activity modification, and sometimes medications like even injections. Now, most knee pain can be initially managed at home with rest, ice, compression, and elevation, the RICE protocol. But certain signs indicate you need medical evaluation right away. So I want you to see a doctor immediately if you heard or felt a pop in your knee during an activity or injury. This is suggesting ligament or meniscus tear. If you have severe pain and can't bear weight on your leg, see a provider. If your knee is obviously deformed or misshapen, that suggests fracture or dislocation. If you have rapid, significant swelling within hours of the injury, that suggests bleeding in the joint from ligament tear. If your knee feels unstable or gives out when you try to walk, that indicates a ligament injury. If you have a fever along with that knee pain and swelling, well, that's starting to suggest infection, which is a medical emergency. And if you have redness, warmth, and severe pain, that's starting to also suggest localized infection in the knee joint itself. If your knee locks up and you cannot straighten or bend it, that's starting to suggest a meniscus tear or a loose body part inside the joint. So you need to see a doctor within a few days if your pain hasn't improved after a week of home treatment, or if you have persistent swelling, or you have pain that interferes with daily activities or sleep, or you have instability or feeling that your knee might give out at any minute. You need to see a doctor if you're an athlete and you want to return to sports. Even seemingly minor injuries should be evaluated before ever resuming activity. Don't ignore knee pain. Early diagnosis and treatment often prevent more serious problems down the road for you. Now, how do doctors diagnose the cause of knee pain? Well, it starts with a thorough history and physical exam. So the history is where your doctor will ask about when and how the pain started, what makes it better or worse, what's the location and quality of the pain, is it associated with symptoms like swelling or instability, your activity level and sports participation, and have you ever had any previous knee injuries? And then they do the physical exam. They inspect it. They look for swelling, deformity, decrease in muscle size. They palpate or touch it, which is where they press on specific structures to identify tender areas. They check the range of motion to see how far you can bend and straighten your knee. They do stability testing, which is specific tests for each ligament to assess for tears specifically. And then there are special tests like McMurray tests for the meniscus tears, patellar apprehension tests for your kneecap. And there's so many more that is beyond just this talk. Next would be imaging. So x-rays, right? X-rays show bones, fractures, arthritis, and misalignments. They don't show soft tissue like ligaments or meniscus. MRI is what shows soft tissues, ligaments, meniscus, and cartilage, and tendons. I mean, MRI is the gold standard for diagnosing most knee injuries. So a CAT scan or CT scan is occasionally used for complex fractures. Ultrasound can sometimes show tendon tears, bursitis, or the Baker cyst, that fluid-filled sac behind the knee. And sometimes arthroscopy, which is surgery. You know, a diagnostic arthroscopy, which is a minimally invasive procedure where a camera is inserted into the knee, and it's both diagnostic and therapeutic, meaning the surgeon can see inside the knee joint, often see the problem, diagnose it, and then repair it at the same time. The combination of history, physical exam, and appropriate imaging usually gives a very clear diagnosis, and that's what guides the treatment. Next is treatment for knee pain, and it depends entirely on the underlying cause. So let me walk you through some treatment approaches for different types of knee pain. So there is conservative treatment. That is the first line for most conditions. This is things like rest and activity modification. So you reduce or avoid activities that aggravate the pain. Things like ice, where you want to do 15 to 20 minutes several times a day to reduce that inflammation. And then compression, using an elastic bandage or a knee sleeve to further reduce that swelling. And then elevation. You want to keep that knee elevated when you're resting it. And then consider anti-inflammatory medications like ibuprofen or naproxen to reduce pain and inflammation as well. And then what about physical therapy? This is crucial for most knee conditions. Physical therapy includes things like strengthening exercises, particularly for quadriceps and hamstrings, stretching to improve the flexibility, gait training for correcting walking patterns, balance and proprioception correcting, and manual therapy techniques as well. And then stronger, I guess the key here is that to know that stronger muscles around your knee will stabilize the joint and reduce stress on the injured structure. And physical therapy is often the most effective long-term treatment to do that. And then what about weight loss? I mean, if you are overweight, losing weight dramatically reduces stress on your knees. Each pound of weight loss reduces 4 pounds of pressure on your knees with each step. Even modest weight loss, 10 to 15 pounds, can significantly reduce knee pain. And then bracing and orthotics. Knee braces provide that support and stability for ligament injuries or even arthritis. And then shoe inserts, or what's sometimes called orthotics, they can correct those biomechanical problems like gait when you have a limp that sometimes contribute to knee pain. And then sometimes you have to consider injections. These are steroid injections that reduce inflammation and pain. These are effective for arthritis flares, bursitis, and some tendon problems, but the effects last weeks to months and are not permanent, right? And you don't want to try to repeat them indefinitely because they can actually cause tendon injury long term. And then you got hyaluronic injections, which are called the gel injections. This is for osteoarthritis. These are a supplement that naturally lubricate the joint in your knee, right? They results are good, they vary, but some people get really good relief. And then plasma-rich platelets. These use concentrated platelets from your own blood to promote healing. Evidence is mixed, but some patients with early arthritis or tendon injuries seem to benefit the most. And then common medications are over-the-counter NSAIDs for inflammation and pain. You've got topical analgesics like creams or gels. You've got surgical options even, and that's when conservative treatment fails. You've got things like arthroscopy, which is a minimally invasive surgery to repair or remove torn meniscus, repair some ligament injuries, and even remove loose bodies inside the knee, and it can clean up that damaged cartilage. And then there's ACL reconstruction. That's surgery to rebuild a torn ACL using a graft. This is really standard of treatment for active individuals with complete ACL tears. And then you've got meniscus repairs or a partial meniscectomy. This is repairing torn meniscus when possible or trimming damaged meniscus tissue. And then there's cartilage restoration procedures. I mean, for younger patients with focal cartilage damage, it's ideal to just do cartilage restoration. And then there's osteotomy. That's the cutting and realigning of bones all together to shift weight away from damaged parts of the knee. Partial or total knee replacements. This is for severe arthritis and is typically reserved for the older adults with advanced arthritis. Now, the treatment approach should really, like I said, start conservative. Do that rest, physical therapy, medications, injections, and then if conservative treatment fails after several months, then consider surgery. The goal is always to maximize function and minimize pain with the least invasive approach possible. Most knee problems improve with conservative treatment. Surgery is needed in specific situations, complete ligament tears in active people, mechanical symptoms from meniscus tears, severe arthritis affecting quality of life primarily. Now, certain populations have particularly high rates of knee pain and face unique challenges, such as athletes, right? Contact sports athletes is no surprise. They have high rates of ACL tears, meniscus tears, and ligament injuries. And return to sport decisions require careful evaluations. You need adequate healing first and rehabilitation before you ever resume activity. Runners are commonly developing this thing called patellofemoral pain syndrome, like I discussed earlier, or IT band syndrome, and even patellar tendonitis from overuse and training errors. And then, big one, military personnel and veterans. Veterans, particularly those in combat roles or who did jump operations, have extremely high rates of knee problems. Studies showed that knee pain affects over 50% of combat veterans. And this is typically from repeated trauma from parachute operations, running and marching with heavy loads, vehicle accidents and combat injuries. It's chronic wear and tear from physically demanding training. And for veterans, knee conditions are one of the most commonly service-connected disabilities. The VA rates knee conditions based on range of motion limitation, instability, and functional impairment. Veterans with service-connected knee conditions can receive disability compensations ranging from 10% to 60% or higher depending on severity. I mean, the common service-connected knee conditions are things like degenerative joint disease or arthritis, meniscus tears, ligament injuries and residual instability, patellar tendonitis, chronic pain, and limitation of movement. If you are a veteran with knee problems that started during or were aggravated by military service, this is absolutely a condition that you can and should file for VA disability for. Now, another category is elderly adults. Arthritis is common in this group, but by age 60, over 30% of people have some amount of knee arthritis. Treatment focuses on usually maintaining function, managing that pain, and delaying or trying to avoid joint replacement surgery. And if you're overweight and obese, well, excess weight is one of the strongest risk factors for knee pain and arthritis. But here's the good news. Weight loss is one of the most effective treatments. Losing weight reduces joint stress and often significantly improves that pain. And then there are people that work in physically demanding jobs. These are people who spend long hours kneeling, squatting, climbing stairs, or carrying heavy loads that have a higher rate of knee problems than the general population. I mean, occupations I think of are construction, nursing, being a physician, retail, and warehouse work that do a huge disservice to your knee and take a big toll on your knees. Now, a question I commonly get is, can you prevent knee pain? While not all knee problems are preventable, especially acute injuries, you can significantly reduce your risk of getting it. So again, maintain that healthy weight. Reducing excess weight is one of the most effective ways to protect your knees. And exercise regularly. Strong muscle support, and they protect your joints. Focus on those quadriceps and hamstrings specifically, okay? And then I don't want you to skip warm-ups, right? Warm-ups before exercise or sports do prepare your muscles and joints for the activity they're about to experience, and use proper technique. Whether you're exercising, lifting, or doing work tasks, proper form reduces injury risks. And wear appropriate footwear. Good shoes with proper support reduce stress on your knees. And when you're going into starting more activity, do a gradual increase. Don't suddenly ramp up your exercise intensity. Give your body time to adapt. Or consider cross-training. Vary your activity. It reduces repetitive stress on your knees. So overall, I just need you to listen to your body. Don't ignore knee pain. Rest when needed and address problems before they become a real issue and worsen. And also, don't forget to stretch. Maintain that flexibility in your legs, particularly those hamstrings, that quadricep muscle group, and the IT band. And for athletes, proper training techniques, adequate rest between workouts, and specific sports conditioning reduce injury risks. Now, knee pain is incredibly common, like I said, but it doesn't have to control your life. Understanding what's causing your knee pain is the first step towards getting the right treatment. Most knee problems improve with conservative treatment, like physical therapy, activity modification, weight management, and appropriate medications. If you have knee pain, do not ignore it. See a healthcare provider for proper diagnosis. Early treatment often prevents more serious problems and gets you back into your activities faster. So if you like this, I want you to subscribe to this channel for more evidence-based medical information. Listen, I'm Dr. Marshall Bahr, and my goal is to help you understand your musculoskeletal health. If this video helped you understand what knee pain is, hit the like button and share it. Comment below. What type of knee pain are you dealing with? What treatments have worked for you? I want you to take care of your knees. They carry you throughout your life. And thank you for watching. And until next time, stay mission ready.